with myelofibrosis, the only actually potentially curative and disease-modifying treatment is allotransplant. And one of the big barriers to allotransplant in myelofibrosis is the poor performance status of most patients already. It's usually an older patient population, fairly high rates of graft failure. And that's why most patients actually don't proceed to this potentially curative treatment. And there's been no randomized clinical trials that compare transplant with non-transplant strategies. So that was kind of the background why we did this systematic review and meta-analysis to basically give patients and providers a better sense of what is the current state of the literature and what are realistic expectations when we counsel patients in terms of their long-term mortality, long-term outcomes, as well as safety in terms of graft failure and graft versus host disease. And so what we could show is that we identified, I think, over 40 studies with 8,000 patients. And in that, we could show that there's definitely a survival, there's a long-term survival for patients who proceed to transplant. And that's usually not seen with non-transplant strategies, including novel JAK inhibitors like ruxolitinib, although the limitations are clearly that this was not a head-to-head comparison, but like extrapolating that there certainly a rationale to recommend transplant evaluation and then potentially transplant itself for patients with myelofibrosis who are candidates for that intensive therapy.